Thank you very much. It's very exciting to be here. As you know, I spent over 20 years just south of you in Houston, so feel very much like a Texan. So all the Texans in the audience, it's great to see you. I feel a little bit like this is a church where everybody comes early and gets in the back seat, but at least maybe it's warmer back there. I'm really excited to share with you today some of the things that I think are important to the future of nursing science. And I'm very excited to talk about the importance of partnerships within our academic faculty and our clinical settings. And when you look at my past, I spent over 20 years at Texas Children's Hospital, and almost all of my career has been in the clinical setting. So I apologize to some of you academicians if I may say some things that are more related to the clinical side, but I think we have a lot of growth to do, and so I wanted you to know that I shared that kind of past with you. We had the PhD students, and I'm so excited that you're here, kind of stand, but could we just have a show of the audience? How many are academic faculty, researchers, and individuals from academic settings? Great. And then clinicians or clinical researchers from clinical settings. Great, great. So during our time together this morning, I'm going to start by providing a definition of what it means to transform health. And I'm going to provide some insights into nursing priorities that are based on, of course, our NINR research strategies, and we'll talk more in detail about what has just been published in the fall of 2016. And then I'll also spend some time talking about relationships, and I think that's because it's really the focus of this conference, of looking at fostering partnerships between our academic researchers and our clinical researchers. And so I want to spend some time talking about how to build strong research teams. And many of us already have strong research teams that include clinical researchers, and I think we're very familiar with the word symbiosis. And so I'm going to talk about negative, neutral, collaborative, collegial, and then symbiotic relationships. And as we go through this discussion, I hope you'll think about your team of the future, if you're a student, or if you're already a researcher, your existing team, and how we might really look at ways to improve this team. And then last, I will talk about sharing a vision for the future for nursing science. So let's begin by establishing the description of what transforming health really means. And so according to the definition, to transform means to make a thorough or dramatic change in something, in the form, the appearance, or the character. It also means to metamorphose, or to transfigure, or to revolutionize, and I like that word. But I think if we all are honest with ourselves and we look at our research programs, I guess I would have to ask ourselves, how many of us really feel that our research has transformed care? Some of us have. We have some very famous researchers in our audience today that I really can say that have transformed research. But when you look at the reality, and all of us have heard this phrase, that it takes almost 15 years for research to really infiltrate our clinical settings, I think we have a lot of work to do in that. And I think some of us are really disappointed in the fact that it takes so long to actually get into the clinical setting. And this quote is often used, there's more to health than health care. And I truly believe that nursing holds that key to making sure that happens in the future. So the Institute of Healthcare Improvement is a major focus in this country that supports healthcare transformation. And Stifel and Nolan in 2012 published a very important white paper from the IHI on ways to measure healthcare improvement related to the triple aim that was published by them. And that triple aim focuses on first population health, then experiences of care, and then per capita cost as the organizing framework for healthcare improvement. And now that aim has become a quadruple aim, and I really like what they added to this. The IHI has added the work life of clinicians and staff, as an important major aim for focusing on improving healthcare transformation. And if we think about that, that is essential for good working environments, and good working environments lead to healthcare change. So this slide has numerous factors that influence our ability to transform care. And to me, they are overwhelming. I think especially to nurse scientists, they can be very overwhelming because we don't have a lot of expertise in some of these areas. And they're described as environmental forces that drive healthcare transformation. And as many of you can see from this numerous list of categories, that they're very specific to healthcare processes, like healthcare costs, like provider shortages, like federal and state legislation forcing change. These are all key examples of what we really need to be focusing on in healthcare transformation. So we ask this question as nurse researchers: what will it really take to transform health? So as we look at this list that I derive from the literature and many of our established institutions that are looking at really paving the way for healthcare transformation, think about the role of nursing. And then more specifically, think about the role of nursing research. First, our care must demonstrate consistency and excellence. How can nurse researchers promote this in the clinical setting? We must always have in mind that quality improvement is continuous and that our research should lead implementation of quality improvement projects. And I don't think our research is really complete until we see its implementation. And I think we still fall short in this area as researchers. An important example as how science can lead to implementation is the knowledge we now know about symptom management in chronic illnesses such as asthma. In adolescents with asthma, novel approaches are now being used using mobile devices to allow adolescents to assess their asthma symptoms, take appropriate early interventions, and decrease the severity of the asthma attack. And when you look at this slide, regarding the last three bullets, nursing researchers can play center stage by using their expertise in informatics and technology and the use of innovative methodologies in clinical research to become more engaged in major roles that really link to healthcare transformation. An example of this role is that nurse researchers are now using electronic health records to help identify patients who are high risk for readmission, to be able to implement care that is really tailored to prevent readmissions following discharge. So what role does nursing research actually play in all of this talk of healthcare transformation? One of my favorite nursing authors that I read during my doctoral studies was the work of Dr. Barbara Carper, who wrote the book, The Fundamental Patterns of Knowing in Nursing. And for me, as a nurse practitioner who was totally embedded in pediatric oncology in the clinical world, when I read her work, it gave me the reason to pursue higher education. Because her work transformed the belief that science must be more than the practice of nursing. It's not just the science development. It's not just the practice. It's not an either or, but it's a both. And I love how she says that in her work. She writes this: it is this complex relationship between the body of science, the utilization of knowledge, and the application to practice that presents opportunities and challenges for academic nursing. I think her work speaks clearly to the importance of research teams in the future. And these teams must really include both the scientists and the clinical experts who will bring their perspectives to solve important nursing research solutions in the future. So I have to digress just a moment and wake you up, get you a little bit warmer. So have you ever, in preparation for a major talk or a project or something, really got into the internet and you get lost. It's so easy to do. So as I was preparing my lecture and working on this over the holidays, of course I got lost in the internet. And I was searching for nurse research or nursing research, and I came across numerous websites on vintage nurse romance novels. How many knew these existed? We'll see how old we are. Look at this. Here's the more important question. How many of you have ever read one of these? Look at this, and they're honest about it. So I just have to read a short paragraph, and then we'll go on from this book, because you'll enjoy it. And the book is this, which I love, Research Nurse, caught my eye. So research nurse Sue Brinkley's life had seemed complete in the arms of handsome Dr. Luke Connor. But the time came for her to prove her love when a man from her past pleaded for her help and her heart. She went to him, and suddenly her life was torn by fear and terror. Now that makes you want to read it. You're probably going to go out and buy it. But I don't know about you as nurse researchers, but my life as a nurse researcher never sounded like that. But I'll tell you one thing, I'm glad at least the perception of nursing from the 1950s, because these were written in the 1950s, has pretty much changed. All right, so let's move on. A 2014 article in the Forbes magazine told the story of the role nursing can play in transforming healthcare. This article states this: traditionally, nurses have been the face of healthcare for the patient. It goes on to say that unfortunately, however, due to the culture of healthcare industry, nurses have usually taken a back seat to physicians and administrators when it comes to changing the policies and practices of optimizing care. However, there is a wealth of evidence that points to the vital and increasing leadership that nurses now play in healthcare practices across this country. Studies confirm that empowered nurses provide the best patient care, and I think we would all agree with that. And I think the title of this article says it all. Looking to transform healthcare? Ask a nurse. And in thinking about this article, it makes me wonder if perhaps we've been too passive in our voice of the importance of nurses. And now it's time to really speak out more strongly of who we are. And I think, and most importantly as nurse scientists, and what we can provide and bring to the table. Dr. Grady, the director of the NINR, also points to our future and the role nursing science can play. Our goal as nurse scientists is to improve health in various ways in numerous settings and numerous populations. She goes on to discuss in this article the possibilities of us within the healthcare environment should focus on, first, symptom science, the biobehavioral aspects of nursing, data science, innovative methodologies and interventions that can be sustainable over time in numerous health settings, and that is so important right now for research funding. And we'll talk more about these in detail. But let's first look at the strategic plan by NINR, because I think it provides so much insight into our future as nurse scientists. The NINR strategic plan that was published this past fall outlines the areas of greatest need that we as nursing scientists can have the most impact in. So it includes 4 areas of scientific focus. The first is symptom science, promoting personalized health strategies for our patients. And then there is wellness, providing health and preventing disease, and then there is the relationship to self-management. And then there's improving quality of life for individuals with chronic illness. End of life and palliative care, the science of compassion. And this plan also really includes 2 areas for scientific advancement in the future, and I think for this audience they're particularly important. One is promoting innovation, but the other is supporting the 21st century nursing scientists, like those of you in this room. And we'll keep these areas of scientific focus in mind as we continue to talk about this. So let's explore some of the hot areas for discovery right now. Precision health. The 21st century will pave the way for care to become individualized. And there are so many questions in relation to this area that can be addressed by nursing research teams. For example, what personalized markers can be used to clearly identify those patients most at risk for disease-related cancer symptoms? And how might we use those markers to determine who is most responsive to symptom management? And many individuals and nurse researchers have been looking at this for years in the area of adults with cancer. And biomarkers are center stage in the exploration of symptom science and also in precision health. Important questions about symptom precursors must be asked in relation to how we look at, first of all, risk severity and then responses to treatment. There are numerous successful nursing research teams already exploring these, and I think there's a great avenue for even more of you in the future. And then there are the omics, exploring the roles, the relationships, the actions of the different molecules that make up our cells. Genomics, proteomics, metabolomics, all must play significant roles in our exploration in the future. Examples include nurse researchers who are exploring everything from the impact of the gut biome on early development to specific polymorphisms that may be associated with long-term deficits following traumatic brain injury. In Nursing Outlook this past month, Dr. Janet Williams really discusses the importance of genomic precision medicine. And in this article, these authors emphasize that we still all too often fail in our clinical implementation of new knowledge, especially when it relates to genomic discovery. And I think that's an open area for new science. And big data is an important topic. SAS Technologies defines big data as a large volume of data, both structured and unstructured, that can be analyzed for insights that lead to better decisions. As nursing scientists, big data is here to stay. And research teams must really have experts now that are members of the team that are able to analyze big data sets so that in the future we'll be able to have more of a significant impact on the transformation of health. An article on big data in healthcare published in Health Affairs in 2014 describes using clinical analytics to predict outcomes for high-risk patients. And what they've done is they use these analytic models to predict which patients are most at risk for a diverse event, such as infection, or adverse drug events, or even renal failure. And they're looking at the significant impact of policy implications that this might have in the future. And then there is machine learning, described as using algorithms to build analytical models that can help us detect patterns in data. And if you think about this, this is really what nurses do. We look at trajectories of patients over time. We look at symptoms influences. We look at the staff at the bedside who's looking at vital signs over time. Or a nurse scientist evaluating symptom changes following a heart transplant. Or a nurse researcher-led team examining the use of sensors to prevent pressure ulcers in older adults who are in nursing homes. Nurse researchers can become even more involved with how machine learning will be used in healthcare in the future, to be able to use the kind of data to really develop new interventions of care. And then robots in healthcare. Get ready, they're coming, but in reality they are already here. And so the impact and the opportunity for nurse scientists in this area really to me is as big as your dreams. They're already used for years in surgical precision. But what about assistance in the home for better life as caregivers? A 24-hour article in the New York Times wrote about this. These robot caretakers of the future are already used in other countries. So it states this. So just imagine this. Since a robot caregiver won't require sleep, it would always be alert and available in times of crisis. While my patient slept, the robot could do laundry and other household tasks. I think all of us would want this, not just the caregivers. When she woke, the robot would greet her with a kind, human-like voice, help her out of bed, being very safe with her, and making sure she was clean, for example, after she used the toilet. It, she, he, whatever you want to call your robot, would ensure that my patient took the right medications in the right doses, and at breakfast the robot would chat with her about the weather or the news. So think about this. How many of you talk to Alexis every day in your home about the weather and the news? And to me, and I know some of you that are doing elder care and elder care research probably are already looking at these kinds of innovative ways to support our elders in the home, but it's just fascinating to me the opportunities that we have there. In Japan, they're already using these robots, and it's really, to me, there's going to be a wealth of nursing studies in the future that are really specifically related to the types of robots that can give care. So Forbes magazine in November 2016 states, "We can't solve population health without a workforce that knows who and what it is solving for. And we can't treat all patients alike. We must think differently about how we work together, from our patients to our partners to our communities." There are significant disparities in healthcare quality among racial and ethnic minorities in this country, and it's so exciting to see that SNRS already has a focus group that's working on this. The 2016 CDC report on strategies for reducing health disparities stresses the importance of community engagement to explore specific determinants of healthcare outcomes. Again, another rich resource for nursing research studies. 7 out of 10 people aged 65 and older will need chronic illness care. And end-of-life care continues to be a major problem for us. There are so many challenges that remain to assure quality of care is given for patients at the end of life. So these major areas of focus for the future are all rich areas for nursing research. But this exploration is not done without a strong research team. And I truly believe that you can have the most innovative question possible, especially for you as PhD students. I really want you to focus on this. But without a strong research team, these questions really will not influence healthcare transformation. So I'd like to spend a few minutes talking about these working relationships and these research teams, and talk about the important different types of relationships. And as I'm talking, think about the kind of relationships that you are developing or that you already have right now in your working relationships on research teams. Relationships within the team are really key to success. The theme for this talk today is about building our relationships between researchers in academic settings and clinicians and researchers in clinical institutions. And so let's talk about the different possibilities of these relationships. And while I'm doing that, I want you to think about your team and how your team interacts. And then if you are a doctoral student and you don't have a research team yet, think about what you would like your team in the future to be like. So frustration, hostility, resignation are present in negative types of relationships. And this comic reflects these types of negative relationships. Never talk down to patients. I'll be back to explain why when the big hand's on the 12 and the little hand's on the 2. And I think we've all been in these kinds of relationships before. Statements from our research teams, however, often are something like this. I watch myself carefully in team meetings. These are often reflective of how other team members are feeling in these types of relationships. The PI or senior researcher may be abusive or critical of other team members. The clinical expert is often not given the respect that they should. There is no trust on this team. I've seen fatal design flaws in research studies because the PI refused to listen to the clinical experts who had concerns about the research design and its possible interference in the clinical setting. So in negative relationships, there's a near absence of feelings. There's often only information exchange that happens in the meetings. Research teams are present, but they really provide no input into the decision-making aspects of the research project. Team members, especially the clinical experts on these teams, feel they don't contribute much. The relationship is formal, it's sterile, and these neutral relationships are often promoted by lack of communication and lack of participation in the project. I've seen this over the years with interactions between academic faculty and, again, clinician researchers. And it seems there's a defense from the clinical side, and that they don't want this person from the ivory tower to enter their clinical setting and tell them what to do. But at the same time, we see it on the academic faculty side, where they are coming from the perspective that this is my research and you shouldn't tell me what to do. And when we think of this, if you look at both situations, neither are right. They are both flawed in their thinking. So how do we evolve to a more collaborative relationship that's good, or even great relationships among our research teams, where team members work together, where there's trust, where there's respect, and where there's power? Collaborative relationships are promoted when the nurse researcher or the clinician researcher really has experience and knowledge, and there's mutuality among the team. The power is still not equal in these collaborative relationships, but they really do have shared responsibilities. There's open communication, there's constant interactions over time, and there's building of trust over time. And I think all of us know that have had research teams for some time, that this happens very slowly. It doesn't happen overnight. And I would suspect that most of our research teams get to this point of having collaborative relationships if they continue to be successful in grant funding. So this cartoon says this: he'll need some blood thinner immediately, but go grab me a sandwich first. And so again, this cartoon does not demonstrate collaborative relationships, but we often make others feel this way on our research teams. Success on a team is demonstrated by the ability to labor together. Working together jointly isn't, though, as easy as it seems, and I think that word labor tells us a lot about how difficult it is sometimes to develop these long-term relationships. These kinds of relationships on a research team, again, develop over time, and it's that laboring together that builds trust and confidence in each other. So what is the difference then between collegial and collaborative relationships? In true collegial relationship, team members really feel equal to each other. The PI has the knowledge as a researcher, but other team members also have equally important knowledge that they bring to the team. Many times the research team members, especially the clinical researchers, may know more about the day-to-day details of your study than the PI actually does. On these true collegial teams, the power is equal, The trust, again, is shared, and communication really leads to that collegial relationship. These are described as excellent relationships, and they are based on the concept that we as professionals are different, but we are all equal. And that's really the essence, I think, of building this collegial relationship. So why are these such important issues, and why am I belaboring this? Well, I think we can look to the clinical world to give us some answers about why this kind of characteristics in teams are so important. For example, relationships in the clinical setting have a direct impact on patient care, and there have been numerous publications about this over the years. Collegiality and collaboration are strong indicators of patient care quality. Several researchers have evaluated specific patient outcomes related to positive collaboration in relation to things such as decreased mortality, fewer transfers back to the ICU, reduced cost, decreased length of stay, patient satisfaction, and higher nurse autonomy, retention, nursing perceived quality of care, and nursing job satisfaction. So since we have all of this evidence of the impact that positive relationships can have on patient care, to me it makes good sense that fostering these kinds of relationships within our research teams is very important. So last, what does it mean to have a symbiotic relationship with each other? The literature points to this as being so important, and that's building a safe culture within your research team. This is achieved by active listening, by taking turns speaking, something we don't often do on busy research teams, sharing with each other, sharing experiences, and inclusion of all team members in the activities that you're participating in. And so for us as successful researchers, there's a balance in our symbiotic relationship that really has to occur to ever get to this point. So how do we build that bridge of developing increased symbiosis among academic and clinical researchers as well as clinicians? I can say from experience that it takes time and commitment to develop these positive relationships, and they are essential to building that bridge between the academic setting and the clinical environment. And again, we see these things as being essential to that. Respect, valuing expertise, listening to others, managing conflict wisely, avoiding negative behaviors, organizing, and motivating the team. And it does take great effort to get to this stage of your research team development. One of the biggest challenges of working together is a cultural and an organizational one. And so for schools of nursing and healthcare institutions to really work together, it takes leadership at the top to really become supportive in this collaboration, especially in relationship to nursing science. This is really important because expectations of interactions are really led by example, if you think about it. And so if we have administrators, both in the academic setting and the clinical institutions, that don't get along, they really set the stage for the rest of us to decide how we are going to interact with each other. For us as nurse researchers, it starts by building that environment that's conducive to facilitating faculty in academic settings to work jointly with clinical experts and researchers. And that environment must really facilitate and support team building and the use of individual strengths from both settings in order to form a very productive team. Many of you across the country hopefully have initiatives like this to bring together nursing faculty and individuals that are clinical experts. The Duke Advancement of Nursing Center of Excellence, and it's called DANCE, does just that. It includes leaders from the School of Nursing who work with the top administrators at the healthcare system to build that environment of collaboration and trust. And dance is grounded in a partnership between nurses, both in the healthcare system and in the School of Nursing, to promote, again, collaboration, synergy, and professional development. And it's through initiatives like this that really these future symbiotic relationships that I've been talking about can really develop. So let's look to the future now and talk a little bit about what I see as the future for nursing science. And here's a list that I've created that lists some of the most important things that I think are must-haves to be successful, and we'll spend some time talking about these. First, transdisciplinary research teams, PhD and DNP research teams, entrepreneurship, technology experts. Big data science is here to stay, and so it's key for us to consider that as we're looking at our future. Artificial intelligence, as we've talked about. Genomic and biological exploration. Always considering the importance of looking at health disparities. And then we'll talk about the importance of now being open to alternative grant funding for our future research endeavors. So we all know, as we've talked about over the last few minutes, that successful research teams take an army of experts. And the new word on the street now is transdisciplinary, and it means relating to more than one brand of knowledge. These teams now really reach beyond the traditional nursing and physician research teams, and they really work together to include a diversity of professions that are unique to the focus of the research study and that are unique to the needs of the experts that you need to build onto your research study. Each member of the team has specific knowledge that they bring to the team. So let's talk about the PhD and DNP for a moment and consider first these numbers as you're thinking about this. These come from the AACN. From 2014 to 2015, the number of students enrolled in DNP programs increased from over 18,000 to almost 22,000. In 2015, 2 years ago, the estimated total DNP graduates already practicing were near 60,000 nurses. In 2014, the AACN reported that there were just over 5,000 nurses enrolled in PhD programs across the country. So there will always be more DNPs than PhDs. And they'll continue to be engaged in clinical settings where health transformation will occur. And so my opinion is that if we as PhD nurses don't learn to engage DNPs in our clinical settings in research, other disciplines will begin to do so, and we're going to lose out on that. So I believe it's time for DNPs and PhDs to come together, bringing their unique expertise to form the team to really bridge that gap between our clinical institutions and our academic nursing settings. And let me just give you an example. There's a current study at our institution to examine the clinical effectiveness of a DNP model of care for heart failure patients that was implemented by a team that consisted of a nurse scientist, 2 DNPs responsible for the heart failure clinic, a cardiologist, and several data technologists that really looked at help us integrate the electronic healthcare record into the research study data repository. This study was funded by the hospital system. Keep that in mind as we talk about grant funding in the future. And it was really designed to evaluate both healthcare-related outcomes, looking at physical function capacity, endurance in heart failure patients, as well as that patient DNP provider communication and satisfaction of care. So let's talk about technology. And it really must be considered in our future projects if we're really going to be successful. Mobile health technologies, robots as providers of interventions that we've talked about already, sensors for early detection of disease status change are just a few examples of what the future holds. One of our stellar researchers at Duke is working now with faculty at the School of Medicine and the School of Engineering to integrate mobile technologies into first-generation robotic healthcare delivery systems. Their human-controlled nurse robot, called Trina, provides functionality for patient communication, mobility, manipulation, specimen collection, and sensing of patients' vital signs. By fostering these types of collaborations between scientific experts and technologists, there's really an exciting future for nurse scientists in this area of technology. And we can't talk about future nursing scientists without talking about genomic and biological exploration. In 2013, the blueprint for genomic nursing science was published to recommend priority considerations for research. And I will mention, excuse me, get back. I'll mention just a few of those, just to give you an idea, and apologize for that. First, that paper talked about the importance of focusing on risk assessment within health promotion and disease prevention. For example, studies using markers such as pro-inflammatory cytokines to examine symptom responses to illness and treatment can increase our understanding of how to design interventions that could minimize cytokine-induced responses. Another important area of genomic research that was discussed in that article is on communication of genetic risk information and its effect on decision making. For example, evaluating the psychosocial and ethical implication of disclosing genetic information to patients and their families should be a major interest for nursing science. Questions regarding whether information should be disclosed at all, how much to disclose, and even who provides that information for many of the genetic diseases will continue to be important areas for us to explore as nurse researchers. Managing symptoms at the end of life and supporting patients and families with essential decisions that must be made during this time is also a focus for nursing research of the future. A great example of this is a multi-site Alex's Lemonade Stand Foundation grant where nurse researchers are evaluating symptom frequency, the severity, and the distress in children with advanced cancer through the end of life. They're assessing the feasibility of electronic data collection both in the hospital and the clinic and even in the home environment. And this team is a great example of what can happen when researchers join with clinicians to build that symbiotic relationship. On this team, there's a nurse scientist, there are 2 senior mentors, and there are advanced practice nurses at 5 different sites from around the country who are serving as PIs on this study. The possibilities are endless for scientific discovery in the future, but there is a big question that all of us worry about. And I don't want to put a damper on our excitement as we think about our future, but I do want to spend a moment on the F word. We must ask ourselves, where will these funds come from? Who's to pick up the tab for all of this wonderful nursing science in the future? And I think you can see here from this slide that there's only a small amount of NR funding from the entire NIH appropriations. And I think we all worry about cuts in federal funding. They're threatening to slow down our scientific discovery. We all know there are challenges in obtaining these grant funding opportunities, and the typical scientist spends 40% of the time writing grants. And I know many of us feel this way, that we have one grant funded, and the next day we're writing the next grant, and that kind of never ends. The bottom line, though, is that we've got to become more creative in our search for funding. And if you haven't seen the Pivot or worked with Pivot, the second bullet on this list, it's a great type of software package that helps you really look for innovative ways to find grant funding. And at our institution, we use it to help junior faculty look for things that aren't as well known. I've listed a lot of websites here to give you some opportunities to really consider things for funding in the future. And the one thing I also wanted to kind of go back to for just a second was to remember that some of the examples that I talked about today really support the fact that if we as nursing scientists become more engaged in discovery, that has a great and direct impact on the healthcare setting. Perhaps in the future, those institutions and those healthcare settings will be more supportive and more agreeable to funding some of our work. And so as we begin to develop these teams over time, I'm hoping that some of our healthcare institutions will also be much more involved in grant support. And I included these websites in my slide. There's a grant. I'll just do a play for the grant writing, the grant funding session tomorrow morning. I think that if you're interested in hearing about more grant opportunities, don't miss that session because you're going to hear a lot more about opportunities for funding. But the real message that I end with regard to grant funding is that you've really got to think outside the box. And as researchers, all of our monies can't come from NINR or even NIH, as we know. And as you saw previously, there's just not enough to go around there. And so start thinking outside the box for your funding. Our continued success in the pursuit of scientific discovery within nursing does require change, as we have talked about it, and as we move forward. Traditional ways of scientific exploration, a focus on one researcher project, traditional methods and analytics, and previous funding strategies may become a thing of the past as we move forward. And for many of us who have been researchers for some time, this time is stressful for us. And I like to look at the work of Cotter on successful change for insight. And if you haven't read his book, My Iceberg is Melting, it's a good read about what's happening in nursing science right now, and really actually even in the country right now. It's a simple story of a group of penguins, and they're going to lose their iceberg because it's melting. But through teamwork, building trust, this little penguin colony learns how to work together. They get through, they begin to face the future, and they take action about what needs to change. And I believe we need to follow these steps to build nursing scientists of the future, both within academic settings as well as in clinical institutions. And I like his steps to successful change because I think for any researcher, whether you're in an academic setting or you're in a clinical setting, they really do hold true for us. Create a sense of urgency. Pull together the guiding team. Develop the change vision strategy. Communicate for understanding. Empower others to act. Produce short-term wins, don't let up ever, and create a new culture. And I think that new culture will continue to support nursing scientists of the future. And so I'll end with what I think is the essence of researchers, both in the academic and clinical settings. And that I believe we are first nurses. And this quote says it well for all of us who see ourselves as first a nurse. It takes a very strong, intelligent, and compassionate person to take on the ills of the world with passion and purpose and work to maintain the health and well-being of the planet. And I love this phrase just as much as all of it. No wonder we're exhausted at the end of the day. Thank you.